if you really think about it, looking at a beautiful dog like a Samoyed is, well, it's a lot like admiring a high-end luxury car.
Oh, absolutely.
Like when you see it parked on the street or walking back into the house after a brisk winter walk, the paint job, or in this case, that brilliant cloud-like white double coat, it just looks absolutely flawless from 10 feet away.
Yeah.
You see that famous smile, the bright eyes, and everything just reads as perfectly engineered.
Yeah.
Perfectly healthy.
It's an incredibly striking visual. I mean, there's no denying that. But any seasoned car owner understands that admiring the exterior polish doesn't tell you a single thing about how the engine is actually running.
Right.
To know what's happening mechanically with that vehicle, you really have to pop the hood and get your hands dirty.
Which brings us to our mission today. Welcome to the deep dive. We are taking a massive stack of veterinary research, breed-specific manuals, and comprehensive care guides, all focused on the health, maintenance, and the silent signals of the Samoyed breed. And our goal today is to extract the absolute most vital insights from these materials to help you, the listener, look past that beautiful exterior and understand the true biological reality of the animal underneath.
And we should probably establish right away what this analysis is not. I mean, this isn't a doom and gloom medical lecture meant to paint these dogs as fragile creatures constantly on the verge of a breakdown.
Yeah, definitely not.
Right, because Samoyeds are robust, incredible, capable, working dogs. Instead, we're looking at an empowering framework for proactive observation. There's a brilliant philosophy woven through our research today that really frames this up perfectly. It says, health awareness doesn't take away the Samoyed's smile. It protects the life behind it.
Oh, I love that framing so much. It moves you from being just a passive admirer of a pretty dog to being an active guardian. So let's start with the most obvious defining feature of the breed, right? That massive double coat.
Yeah, the fluff.
Exactly, the fluff. Reading through the materials, it becomes really apparent that this coat is essentially a master of misdirection.
It acts as a total illusion. To understand why, you have to look at the anatomy of a double coat. You have this harsh, straight outer layer of guard hairs designed to repel water and dirt, and then underneath that, a dense, woolly undercoat designed for extreme thermal insulation.
Right.
When you put those two layers together, you get a physical barrier so thick that it completely masks the actual body condition of the dog. A Samoyed can gain or lose a significant amount of weight or experience severe muscle atrophy, and their silhouette won't change one bit.
It also completely conceals the skin. The literature uses a term I found fascinating. They call it skin surveillance. It completely reframes the entire chore of brushing your dog.
It really does.
When you're working a comb through that undercoat, you aren't just trying to make them look fluffy for the dog park. You're actually running a diagnostic check. You're feeling for unusual lumps, structural soreness, parasite activity, and, well, mats. And we need to pause on mats for a second.
We definitely do.
Because before reading this, I thought a mat was just a cosmetic annoyance, just a tangle. But a tangle of fur is actually biohazard.
It really is when you break down the biomechanics of it. A mat isn't just knotted hair. When that dense undercoat twists together tight against the skin, it creates a completely impenetrable microenvironment.
Wow.
Yeah, it blocks all airflow to the skin while simultaneously trapping body heat, environmental moisture, and dead skin cells. You are effectively building a localized greenhouse on the dog's body.
Which sounds awful.
It is, because that is the exact recipe for acute moist dermatitis, which veterinarians call a hotspot. It's an aggressive, rapidly spreading bacterial infection that happens entirely out of sight under the fur.
Okay, so let's play this out. I'm doing my skin surveillance, and I notice my dog is constantly scratching their flank, or I find an area of red, irritated skin. I know from talking to other dog owners that the immediate knee-jerk reaction is to drive to the pet store and buy a different bag of kibble.
Right, exactly.
Like, ooh, my dog is itching, must be chicken allergy. Is that actually the right biological move?
Veterinary consensus strongly advises against that reflex. Food allergies in dogs are actually far less common than environmental allergies or parasite issues.
Really?
Yeah, so when an owner immediately starts swapping out proteins, moving from chicken to lamb to salmon, or trying random over-the-counter topical sprays, they're just muddying the diagnostic water.
You're essentially just throwing darts in the dark, hoping one hits the target.
And while you're throwing those darts, the underlying issue is likely getting worse. The root cause of that itching might be a flea allergy. It could be a gap in the grooming routine causing the micromats we just discussed, or it could just be pollen in the backyard.
Right.
If you just keep changing their diet without veterinary guidance, you delay finding the actual solution, and you risk causing secondary gastrointestinal distress right on top of the skin issue.
So the major takeaway for you as an owner is that you have to learn to feel your dog, not just look at them. You need to know what their ribs feel like under that wool and what the muscle tone in their hind legs feels like.
Exactly.
And you can't just guess. You really need your vet to put your hands over their hands during an exam to establish that physical baseline. Because if you miss the fact that your dog has quietly gained 5 pounds under all that fluff, you're walking right into our next major area of concern, which is joint strain.
Let's follow that causal chain because it's important. You have a medium to large working breed. A few extra pounds hidden under a double coat might not sound catastrophic, but think about the physics of a dog's anatomy.
Okay.
Dogs carry a significant portion of their weight on their front assembly, and they rely heavily on the angulation of their rear legs for propulsion. So hidden weight puts exponential mechanical stress on the hips, the elbows, and the knees.
And these are highly active dogs. They run, they pull, they jump. The research points out that because they're so stoic, they won't necessarily yelp when their joints hurt. Instead, they compensate mechanically.
They adapt.
Right. So we're supposed to watch for things like a shortened stride, slipping on hardwood floors because they lack the muscle tension to stabilize themselves, or a bunny hopping gait. I want to unpack that last one because it sounds cute, but it's actually a massive red flag.
Mechanically, a bunny hop is a brilliant, albeit tragic, compensation for pain. In a healthy stride, a dog's hind legs move independently in a fluid, alternating motion. This requires a full, painless rotation of the hip joints.
Got it.
If a dog has hip dysplasia or severe osteoarthritis, rotating those joints independently causes sharp pain. To avoid that rotation, the dog will fuse the movement, bringing both hind legs forward at the exact same time, just like a rabbit.
Oh, wow.
Yeah, they're using their lower spine to throw their legs forward, bypassing the hip joints entirely.
Once you understand the mechanics of that, you can literally never unsee. It's a huge indicator of hidden pain. But we have to layer another variable on top of this. When you have a dog carrying extra weight, struggling with joint pain, and generating a ton of internal exertion just to move, and then you wrap that dog in extreme thermal insulation, you get a massive vulnerability to heat stress.
We really have to respect the evolutionary history of the Samoyed here. They were bred by the Samoyedic peoples of Siberia to herd reindeer, pull sleds, and survive sub-zero temperatures.
Which is incredibly cold.
Exactly. Their physiology is optimized for cold preservation, not heat dissipation. Dogs don't sweat like humans. They rely almost entirely on panting to exchange hot internal air for cooler outside air. If the outside air is hot and humid, that cooling mechanism completely fails.
I always try to visualize it like this. Imagine a highly trained, deeply driven marathon runner. Now force that runner into a heavily insulated waterproof winter parka and tell them to go sprint on black asphalt in July.
It's a perfect analogy.
That is the reality for an energetic Samoyed in the summer. Hot pavement, high humidity, and direct sun aren't just uncomfortable for them, they are actual physiological crises waiting to happen.
The transition from just getting warm to a life-threatening heat stroke happens frighteningly fast. When a dog's internal temperature crosses a certain threshold, the proteins in their cells literally begin to cook and break down.
That is terrifying.
It is. Blood vessels dilate, blood pressure drops, and you start seeing signs like excessive panting that refuses to settle, gums turning a dark brick red, thick ropes of drool, confusion, and eventually collapse.
And here is the piece of research that gave me absolute chills. We already established these are working dogs. But the literature emphasizes that a Samoyed's enthusiasm to work can and often will outlast their heat safety.
Centuries of selective breeding have created a dog with immense stamina and a deep psychological drive to perform. When a Samoyed is running, playing, or pulling, their brain's reward center is just lighting up.
They're having the time of their lives.
Right. And that dopamine rush can actually drown out the signals from their hypothalamus, screaming that they are overheating. They will literally push themselves into heat stroke because their working drive overrides their survival instinct.
Meaning they're never going to tap out. They aren't going to walk over to you and say, hey, I need a water break in the shade. The call to stop must come from you. You have to be their external heat regulator, enforcing downtime, providing cooling mats, and keeping them off the pavement.
Exactly. Because their instinct is just to keep running until the engine blows. That is the true essence of proactive guardianship. You are managing the environment because they won't.
So let's shift gears a bit and look behind the Samoyed's most famous feature, The smile. The upturned corners of their mouth are iconic. They makes them look constantly happy. But the medical research drops a pretty hard reality check on us here. A happy expression tells you absolutely nothing about the biological reality inside their head.
The Samoyed smile is just an evolutionary structural feature. The upturned lips actually served a purpose in freezing climates. It prevented drool from forming and freezing into icicles on their face.
So it's architecture, not a mood ring.
Precisely. And unfortunately, that perpetual smile means owners can very easily overlook severe dental disease.
The guides specifically highlight unexplained bad breath.
Oh.
And it's wild how many people just laugh that off, like, oh, he's got dog breath. But it's not normal, is it?
Unexplained, foul breath is the scent of active decay and bacterial infection. And what we understand now about veterinary dentistry is how systemic that infection becomes.
What do you mean by systemic?
Well, a dog with severe periodontal disease isn't just dealing with localized pain in their mouth. Every time they chew, that bacteria is pushed into the bloodstream, where it travels directly to the heart valves, the liver, and the kidneys. Dental discomfort quietly cascades into chronic systemic health issues.
It also just wrecks their quality of life. Think about how miserable you are when you have a toothache. Your nervous system is constantly on edge. You don't sleep well, you're irritable, you lose your appetite.
Exactly.
The literature tells owners to watch for subtle mechanical shifts, like a dog chewing exclusively on one side of their mouth, dropping kibble on the floor while they eat, or frantically pawing at their muzzle. But let me push back for a second because there is a very prevalent piece of advice out there.
Okay, let's hear it.
I've heard countless dog owners say that feeding dry, crunchy kibble naturally cleans a dog's teeth, like an edible toothbrush. Why is dental disease such a huge concern if they're eating crunchy food every day?
Let's look at the physics of that myth, because it is entirely false. Expecting a piece of kibble to clean a dog's teeth is like expecting a pretzel to brush your teeth.
A pretzel? Oh, wow.
Right. When a dog bites down on kibble, the kibble shatters at the very tip of the tooth crown. But plaque and tartar don't accumulate at the tip of the tooth. They accumulate down at the gum line, in the pockets beneath the gums.
So the kibble never even reaches the problem area.
Exactly. The pretzel analogy is devastatingly clear when you think about it.
So what actually does the work?
Mechanical abrasion at the gum line. That means a dog-specific toothbrush and enzymatic toothpaste used regularly, combined with professional veterinary dental cleanings where they go under anesthesia to clean beneath the gums. There is no passive dietary shortcut to a healthy mouth.
Okay, and while we're examining the head, we really have to talk about eye health because the materials make a very intense point here. Redness, squinting, excessive tearing, or cloudiness in the eyes, these are not wait-and-see conditions.
The anatomy of the canine eye is incredibly delicate. Issues like glaucoma, which is a rapid spike in intraocular pressure, or a corneal ulcer from a scratch, can deteriorate from mild irritation to permanent blindness in a matter of hours.
Hours.
Yes, the margin for error is razor thin.
Which leads right into a huge warning from the research. Do not use random, leftover, over-the-counter eye drops you have sitting in your medicine cabinet on your dog.
Doing so can be catastrophic. If a dog has a scratch on their cornea, an ulcer, and you put an eye drop containing a steroid into that eye, the steroid will actually accelerate the breakdown of the cornea.
Wait, really?
Yes, you can literally melt the surface of your dog's eye by guessing. Eyes require immediate professional diagnostics.
Okay, we've covered a lot of ground physically, from the coat down to the joints, the teeth, and the eyes. And this brings us to an incredible synthesis in the literature, which is the mind-body connection. Because unseen physical pain, whether it's an inflamed hip, a throbbing tooth, or a brewing ear infection, it doesn't exist in a vacuum. It profoundly alters how the dog behaves.
Biology dictates behavior. When an animal is in pain, their sympathetic nervous system shifts into a low-grade state of fight or flight. Cortisol levels rise, they are chemically stressed.
So behavior changes.
Therefore, behavior becomes our most sensitive, earliest diagnostic tool.
It's exactly like the check engine light on your car's dashboard. When that little light flicks on, it doesn't print out an itemized receipt telling you the oxygen sensor failed. It just illuminates to tell you that something in the system is wrong. A behavioral shift in your dog is that check engine light.
That is a phenomenal way to conceptualize it. With a breed as expressive as the Samoyed, internal changes often manifest behaviorally before you ever see a single physical symptom.
Like appetite shifts, right?
Exactly. We have a tendency to anthropomorphize and say the dog is just being a picky eater, but sudden food refusal is often a primary indicator of nausea, dental pain, or gastrointestinal distress.
The research lists several behavioral red flags. A dog barking significantly more than usual, or conversely, becoming eerily quiet. A dog actively avoiding the grooming sessions they used to tolerate. Sudden house training accidents in a dog that has been reliable for years, or increased clinginess and hiding.
Yeah, if a Samoyed who usually loves being brushed suddenly snaps at you when you run the comb over their lower back, they haven't suddenly decided to become a bad dog. They are communicating that the tissue or the joint beneath the skin hurts. You have to interpret the snap as a symptom, not a personality flaw.
The literature goes out of its way to beg owners to stop using dismissive labels. We write off these behavioral shifts by saying the dog is just getting old or they're being dramatic. The worst one is calling a dog stubborn.
The concept of stubbornness is one of the most dangerous labels in animal ownership because it absolves the owner of looking deeper. If your Samoyed refuses to go on their normal 2-mile walk and you just label them as stubborn, you stop investigating.
You completely miss the big picture.
You completely miss the fact that they might be experiencing early-stage heat stress, or their knees are aching, or they're fatigued from an underlying metabolic issue.
So we know how to observe the hidden body, we know how to manage the environment, and we know how to decode their behavior. But, if you're listening to this and you have a dog, this feels like an absolute avalanche of information to track.
Yeah.
How do we actually organize this so it's useful when we're sitting in the vet's exam room?
This is where we transition from philosophy to practical data collection. A single odd day in a dog's life rarely provides enough diagnostic value.
Because they have off days, right?
Exactly. Dogs get stomach bugs just like we do. What veterinarians need to see are patterns over weeks and months.
The guides heavily advocate for meticulous record keeping, tracking their weight, noting the quality of their stool, monitoring their exercise tolerance, and keeping a log of vet visits. And they recommend centralizing this data. They specifically mention utilizing tools like the Vital Pet app to keep all this information in one accessible place.
Human memory is incredibly fallible, especially under stress. When you're standing in an emergency clinic because your dog is sick, your adrenaline is spiking. If the vet asks, when did the loose stool start? Or has he lost weight recently? Guessing isn't helpful. Having a chronological written record allows the veterinarian to see the exact trajectory of the decline.
The materials also provide a clear, non-negotiable list of when to bypass tracking and immediately call the vet. An inability to bear weight on a limb, persistent, unresolving stiffness, any difficulty breathing, sudden, unexplained weight loss or gain, suspected toxin ingestion, or any overt sign of acute pain.
Yes, those are emergencies.
And they note that if you have a rescue dog or even a new puppy, you need to establish a veterinary baseline immediately, regardless of where the dog came from.
Establishing a baseline when the dog is healthy is the only way to accurately measure decline. If you don't know what their normal blood work, normal weight, and normal joint mobility look like, you won't recognize when those metrics start to drift.
I have to play devil's advocate here, though. If I am logging my dog's stool quality every Tuesday, tracking their exercise minutes, and constantly checking for a shortened stride, doesn't this run the risk of turning an owner into a complete hypochondriac? I feel like a dog could sneeze, and suddenly you're rushing to the ER in a panic.
That is a completely valid concern, but the framework we're discussing actively prevents that kind of panic. Hypochondria and anxiety stem from the unknown. When you don't know what's going on, every little noise is terrifying.
Oh, I see.
But when you're tracking data, you aren't guessing. You are observing. You learn the difference between an isolated sneeze and a pattern of respiratory distress. It shifts the owner from a state of reactive anxiety to a state of quiet, confident observation.
That is a profound distinction. The data actually grounds you. It prevents you from making the two easiest mistakes with a Samoyed, assuming a problem is just the coat or assuming the dog is just being dramatic.
But precisely, you become an informed advocate.
Let's pull all these threads together. In this deep dive, we've moved past the stunning, deceptive double coat and that iconic evolutionary smile. We've explored the mechanics of joint strain and the intense physiological dangers of heat stress in a working breed.
We covered a lot.
We've unpacked the systemic reality of dental disease, the fragility of the eyes, and most importantly, how every ounce of physical discomfort translates directly into behavioral changes.
We've seen how interconnected the biological systems really are. A healthy dog isn't just a dog that looks good, it's a dog whose internal mechanics and external environment are in harmony.
As always, a quick disclaimer. This deep dive is for educational and analytical purposes only. If you observe any of the signals we discussed today, or if you're concerned about your dog's health, your very first step should always be to consult your veterinarian.
Absolutely. They are the ultimate authority on your specific animal.
But mastering this physical foundation is absolutely critical because it tees up the next phase of our research perfectly. Everything we discussed today, chronic discomfort, environmental stress, physical capacity, it shapes how a Samoyed experiences the world. Understanding their body is the prerequisite to understanding their mind.
Which is where things get truly complex. The vocalization, the independence, the deep psychological traits of the breed.
And that is exactly where we will head in our next dive into this material. But before we wrap up today, I want to leave you with a broader concept to mull over. We've spent this entire time analyzing how a creature as energetic, vocal, and deeply bonded to humans as a Samoyed can so easily and completely mask its physical pain behind a fluffy exterior and a structural smile.
It forces a shift in perspective.
It really does. It begs a fascinating question. If this highly expressive animal can mask its physical struggles so flawlessly that we have to be trained to see it, how much silent discomfort are we missing in the other animals in our lives? Or, for that matter, the people we interact with every single day. Just because a person or a pet looks perfectly fine and smiling from across the room doesn't mean you have any idea what's actually happening under the hood.